Hey everyone, welcome to the training on IEP Review. Today we're going to talk about a few things. The first thing we'll talk about is present levels of academic and functional performance, otherwise known as the PLOF. IDA requires that each IEP must include a statement of the child's present levels of academic achievement and functional performance. A fully developed, well-written present levels is the foundation upon the rest of the IEP. It will lead to appropriate goals, services, supports, accommodations, and placement for the child. If you build a house, the house needs a strong foundation. Present levels are the foundation of the child's IEP. Remember, the IEP is only as strong as its foundation. If the present levels are weak or missing information, it's impossible to develop an IEP that has goals, a program, and placement that meets the child's unique needs. So when we're looking at general academics, these are the things you should be thinking of when you're developing your present levels. How does the child's exceptionality impact his or her access to or progress in the general education curriculum? We have measures of skills from universal screenings and progress monitoring probes that compare the student's skills to the skills of typical peers. The description of the level of skills for reading, math, and written language and how that level compares to the performance of typical peers. Measures of skills in phonemic awareness, phonics, reading fluency, or comprehension compared to maybe grade level expectations. How does the student perform on state or district assessments or classroom quizzes? How does the student's disability impact the student's involvement in the general ed curriculum? What and where are the gaps between the student's skills and the skills of their peers? And what in academic areas are impacted due to the disability? So that's for the academics. For behavior, we want to include information about how the behavior affects the child's ability to progress or access the general curriculum. If the student is spending time in the hallway or in the principal's office due to behavior, that prevents the child's ability to access instruction. Remember, behavior is a result of not only the student's skills, but also the student's environment. So descriptive statements such as given a large group instructional environment or in activities that encourage movement provide an understanding of a child's behavior within context. So let the reader know and let us know what's happening with that behavior and where we can see it. So here are some examples. For a student with a severe disability, we may need to include pre-reading strengths, such as the ability to orient a book, engage in joint attention, and so forth. Also, it's appropriate to discuss the student's current performance compared to his or her past performance. Do not underestimate students with significant needs. Always consider using the general standards first and then look at available extensions or links to the standards. Tying instruction to standards ensures that the program developed is directed at the same end goal as programs developed for non-disabled learners. For early childhood students, it is participation in developmental appropriate activities. The term appropriate activities includes activities that children of the same chronological age engage in as part of a preschool program or in informal activities. Examples may include social activities, pre-reading and math activities, sharing time, independent time, listening, and skills like that. So our transition present levels, really we're looking at current skills related to this post-school employment. Independent living and post-secondary training or education should be addressed by the IEP team and included in that present levels. A description of the degree of match between the student's current skills and the student's post-school outcomes in each of these areas describes the impact of the exceptionality and provides information regarding comprehensive transition planning. Basically, what that means is our skills should match what they want to do in their post-graduation. So you can see here in the new ed plan, our academic achievement, we're describing the student's strengths and abilities in the domain of academic achievement. Here's where we're going to have all those things that we just talked about in terms of their academic functioning and ability. We might compare them with the general ed in terms of testing, all of those things. So what are their strengths? What are things they do well? Does it affect involvement in the progress in the general education curriculum? And in most cases with our students with IEPs, that's going to be yes, because there has to be an impact. And then we're going to talk about how the disability affects involvement. So make sure you're addressing all of the areas. So if you have math, reading, writing, maybe behavior, all of those things, you have to put how each area impacts them in the classroom setting, not just they don't keep up with things at the same rate as their general ed peers, but specifically how, for example, difficulty with reading comprehension would affect a student in a classroom. And then, of course, do they have priority educational needs? Meaning, do they need goals associated with that? And if there are strengths and there are needs, then yes, we're gonna make sure that we have goals to address those skills. So remember, it's much easier if you set them up in sections. We did this in Enrich. We can still do this in Ed Plan. So you have your reading, writing, math, then you have your functional. You might have your related service, OT, PT. You may have behavior, other areas in which we'd address. And when you do that, you could do that set up in those sections if that's easier. It makes it easier to read, and it makes it a little more user-friendly if we do it that way. But remember that everybody has to have academic and functional or behavioral and functional strengths and weaknesses. We have to address it. Even if there aren't any weaknesses, we're still going to address, for example, functional needs. Stay away from judgment statements. Don't say things like, it's a nice boy, dresses well. Those are all observational and they're judgment. We can't prove that with data. Top present levels, which is that one we just talked about, the strengths in the general comparison to how they're doing compared to their peers. So that's the best place to kind of put where they're compared to their peers. Impact statement must be specific. Like I said, you can't just put just unable to keep up with the general ed curriculum. Here's an example. Annie's disability in the area of auditory processing and auditory memory causes her to have difficulty processing problems and remembering information presented orally. This impacts her comprehension and her ability to follow multi-step directions and recall complex concepts. This also impacts her academic success in all instructional settings with oral presentations, including reading, written language, and math, to a lesser degree, science and social studies. So you can see there how specifically it talks about where this impacts her in the general education setting or the general education curriculum. So that impact statement will be needed for each area for which we're going to provide services for the student, or that you've indicated are weaknesses in your present levels. So those findings, this is where that team, basically you're justifying that need for specially designed instruction or special education. We do ask for 2 findings per area. Please don't list them. It's a little different now in this system, but don't list them in the same box, and don't just list a score, right? Remember, IEPs are parent friendly, so just listing a score doesn't have any meaning to a parent. Observation should really not be one because it needs to be concrete data we can pull up and show if requested. Findings are only for areas that we're going to have goals and developed, right? Your present levels leads to your findings, which is going to lead to your goals and or objectives, which leads to your accommodations and then to your services. So this is where all your information from your progress monitoring and programs you are using are coming from. And then we're looking at skill specific. What are the skills? It leads directly to the goals, and baselines are established here in the findings. So baseline data, the most specific information. They're typically collected for the needs that are seen as the most significant. So our students may have a lot of areas, but really you want to pick the most significant areas at one time. And then you can always go back and amend and add information or add goals or add new present levels as things are mastered. But it provides the data for the starting point of those goals to be written. So example of the baseline data would include words read correctly, percent of problems solved correctly, number of times behavior occurs, and maybe a mean length of utterances. For information to be considered a baseline, it must meet these 4 criteria, right? Specific, so clear what is being measured. Objective, so anybody could come by, should be able to score, rate, or measure it. Measurable, something that actually can be measured and able to show small increments of growth. So we don't want big, broad concepts. And able to be given frequently. So you need to be able to collect that information in the same way as often as you send out progress reports. So when you're doing your progress reports, you want to make sure you can collect the information from your progress monitoring to determine how well that child's doing and doing on that goal that you wrote. So if you're having difficulty identifying measures that are specific and measurable, you may be looking at broad concepts or combinations that need to be defined more narrowly. So if you're reading a goal or writing one, you're like, I don't know what I'm supposed to measure. I don't know what this is saying. Then you really need to look at it and define it even more. So a broad concept is made up of many skills. For example, we may have, we'll identify, different types of comprehension questions, or we'll do phonics and then we have fluency and comprehension all in one goal. That's too much. It needs to be one goal, one skill. And then be sure you're indicating, if we're looking at like off task, how often. So again, having that data will help in terms of that baseline, and then going from there, and where do we want the next goal to be. So this here in Ed Plan is what that looks like. So you can see it's a little different than Enrich in terms of those boxes, but here's the same thing: assessment date, the category, the type, the assessment, the score types, and then those findings. That's where you're going to put those findings. So remember, this is just not what they did well on. This is really the areas in which they struggled. So you could say, Johnny had, when given a list of 20 consonant, vowel, consonant words, Johnny was only able to identify 5 of the 20. So we know your baseline is 5 out of 20. So now we know a goal should be addressing consonant, vowel, consonant words with starting from a baseline of 5. So some best practice tips are: be specifically, verbally paint a picture, right? We're helping the reader visualize what the student can do. You're making this section of the IEP actionable. Think about it. If a teacher knows what a student can do, they can plan an instructionally relevant lesson. Identify the student's urgent needs. Capture high-quality baseline data. We're looking at skills, not just scores. Do not just list scores in those findings. Connect the dots. Each section of the IEP should inform the next section. How disability affects statements and statements of present levels of academic achievement and functional performance are, in a sense, two sides of the same coin. When read together, they should present an actionable picture of the student's performance levels and needs. So we should be able to read your present levels and know exactly where that child is functioning in those areas, and know exactly where you're going in terms of your goals and what this child's plan is going to look like. 2 heads are better than 1. Collaborate. Talk with other service providers. Talk with the general education people, teachers. Make sure that between instruction-related service, instruction-related services are often intertwined in each other, right? The present levels performance statement is a vehicle to connect those dots. Provide explicit connections between things such as self-regulation and writing, attentional skills and summarizing, etc. Cast a wide net. Take a thoughtful approach as to how the student's disability impacts that functional performance. Focusing strictly on academics is only half of the requirement, right? Remember, you have to address academics and functional. Remember, a well-constructed present levels of performance statement sets the stage for determining goals, specially designed instruction, and services. It leads to the whole IEP. Think of it like a string or a piece of yarn. Everything starts with the present levels and then carries on down through the IEP. That leads to your goals and objectives, right? 1 skill per goal. Otherwise, it can be hard to determine progress. If you have 3 different skills in one goal, then that child has to make progress in all those different skills prior to moving on. In our district, objectives are required for self-contained students on alternative testing. So, and for, of course, Medicaid purposes for OT, PT, and speech. But for our resource students, if they're general ed testing and they're taking the regular assessment, you do not have to have goals. The objectives are really taking that large goal and breaking it down into smaller steps. As goals and objectives are mastered, which we see, meetings should be held to update. So we can either remove the goal or we can add another one or whatever the child needs at that time, but keeping it so that as we're mastering things, we're moving along and adding new goals. Keep it simple, right? We're not developing goals for the rest of the child's school career. Think about the progress the child's made. What is the rate of progress? So what is achievable based on prior progress and within that year. That IEP is good for 364 days. So what is actually achievable? You don't need to have 20 pages of goals. You need to have what's achievable and reasonable for the student. And then progress monitoring data. So what you put in your, it should be what's used in your findings, right? So when you're doing your findings and you're listing those skills to justify the need for special education, that should be the progress monitoring data you're using. So for example, we did use MAP this past year. So MAP is not really a good source of progress monitoring because that's only given 3 times a year. Now we're using iReady. That's not really good progress monitoring because that's only given a few times a year. So that progress monitoring data should be coming from the programs that you're utilizing in your classrooms or in your resource setting to determine if the child is making progress on their goals. So here's your goal setting. If you remember from way back when or from your college days, we always talk about SMART goals. They want them to be specific, measurable, attainable, relevant, and of course, they're bound by time. So here's a little goal formula format by the time. Typically, we'll see by the end of the IEP, by the end of the school year, usually by the end of the IEP. You can put a date in, but you don't have to. You can just say by the end of the IEP. Student will, what are they going to do? Identify CVC words in unread passages, for example, or in a first grade sight word list. Where will it be measured? In the therapy room, as measured by, how are we measuring it? What are we using for our progress monitoring with how much accuracy? And you can add with blank supports. Sometimes we need support, sometimes we don't. We do ask to include baseline in the goal. So student will increase or decrease from a baseline of blank to blank. That's great. Although it can be in the present levels and the findings, sometimes it's not. So it is okay to also have it in the goal as well. So poor goals are often repetitive to what is already being done in the classroom. Good goals focus on a specific need that has been identified. Poor goals can be easily accomplished without an IEP. Poor goals often have multiple skills and impede that students must meet in order to have progress. Goals should not repeat year to year with a grade level percentage only, right? They have to change. They can't always be the same. So here's an example by the end of the IEP when given a writing prompt of the teacher's choice and a classroom directed. So now we're giving the setting and when. Blank will increase his writing from 5 sentences to 2 paragraphs, staying on topic, asking for help to spell unknown words, skipping lines, and correct mechanics on a writing sample. So there's a lot in that goal, a lot of skills in that goal that would require them to be able to do all of these things at one time. So this is one that we would recommend that be broken into small skills. So our first one might be increases writing from 5 sentences to 2 paragraphs, staying on topic, period. Another goal might be asking for help to spell unknown words. And then the last goal might be skipping lines and correct mechanics. They kind of go hand in hand. By March 2023, when given a 7th grade level text, blank will be able to read the text independently and answer comprehension questions with at least 80% accuracy in 2 out of 3 trials based on biweekly CBM PERS and documented by the teacher reading log. That has just those specific skills. The only thing we would add here is we're saying comprehension questions. Well, what type of comprehension questions? Are we talking literal questions? Are we talking out of the box questions, inference? What types of comprehension questions does a student have to read or answer? By 2023, when given a grade level writing prompt, blank will be able to use evidence from a text at least 2 times within one writing prompt, with 5 or fewer errors and conventions, based on quarterly writing samples and documented by a teacher writing log. So your documentation and everything is great. We want to use evidence from a text at least twice within one writing prompt. And then those are 2 skills. So we have using evidence from a text, and then you also have the next one of 5 or fewer errors and conventions. That would be 2 separate goals because they're 2 separate skills. So here's some more good samples. I won't read them all. I'll just leave them up here for a second as you read through them, but these are really good samples of goals. So then the last thing we're going to talk about, well, I guess it's not the last, second to last, is progress reports. So remember, progress reports go home every 9 weeks. The purpose is to provide parents with an update on where the students are functioning in regard to those goals and or objectives. They must be specific in the comments. Don't just put doing well, working on it. That is not enough. So be specific. You must include the baseline of where the student is currently. So saying things, he has demonstrated good progress towards this goal and is able to produce TH in single words with 75% accuracy with moderate prompts. That tells me exactly where that child is at that time. Making satisfactory towards his math goal with prompting, he's often able to identify the correct operation and accurately solve one-step word problems involving addition or subtraction, approaching the expected 80% accuracy across multiple assessments. That tells us where the child is functioning right now. So when you make those progress reports comments, think of our therapists do it for Medicaid. You have to be very specific, but we too also have to be specific in terms of where they are functioning at that time. Please don't say things such as missed sessions were due to SLP assisting with SE Ready assessment and attending IEP meetings. SLP would check in with teacher regarding goals and provide suggestions. That is not okay because now we're putting in writing that we have missed sessions because of other things. So that child has not received the service they're supposed to, nor have we worked on those goals. We do not want to put that in a progress report in an IEP. The other thing to really not say is this goal is just starting. That doesn't tell us anything, doesn't tell us where they are currently functioning. So as long, I realize that progress reports often take a long time to do, but you can't just do 4 or 5 word statements or say, hey, I haven't seen this child because of all this other stuff, so your child didn't get serviced. Those are not okay to put in progress reports. Now the last thing we'll talk about is prior written notice. So we have done this, we looked at this a few years ago, but remember for prior written notice, we're looking at the blind man rule, right? I should be able, or anybody should be able to read the prior written notice and know what happened at that meeting and what was proposed or what was refused. So remember, we need to use parent-friendly terms, no acronyms, nothing like that. You can use bullets. You're certainly not writing a dissertation or a paper, but it has to be clear enough to understand what happened and what was proposed and what other options are all options that were considered. So we always have an option of considering general education. We may always have an option of considering earning a regular high school diploma, but maybe that was rejected because of the student's cognitive functioning and their needs. But you can't not say, we have to know kind of what happened and make sure that you discuss all the other options considered. Please don't ever put NA. That's not okay because something was always an option and discussed. So here's an example. So if we're talking about what we proposed, so the team proposed to create an updated IEP. On the services page, the school team would like to propose the amount of blank. So you can see here where this is really talking about what's being proposed and basically what's in that IEP. It's not a word for word, Dr. Simmons said, and then Dr. Moore said. You're not putting everything that was discussed at the meeting, but you're putting everything that was proposed and talked about, and not just saying the team met to hold an annual review, and that be it. The student will still receive an IEP. That's not okay. We need information such as this to know exactly what's happening in the IEP. So why are we proposing that, right? Increasing the amount of time for specialized instruction in math is necessary to continue Johnny to solidify his basic math skills. And then they're explaining. Johnny has shown progress in reading class and has gained the skills necessary to become more independent, thus having a 2 student to 1 assistant ratio in the reading class, and would continue to provide the support, but also offer more of an opportunity to be independent. So again, you can see they're justifying for each area they proposed, goals, services, accommodations, all of those things. Why does that child need that? Why was it proposed? And then here we have evaluation procedures. So again, you can have curriculum-based measures, things like that. There you can list things where we put classroom performance, standardized tests, all of those things you can list kind of as the evaluation. And then other teams, there were no other options you could say there are no other options considered at this time. And then here you have the team considered, but you need to clarify that, saying keeping the student in regular classroom for math with the specialized instruction, however, has become much more aware of his level and his math skills. So he needs that resource room to provide the instruction he needs. So those are the things you need to put in terms of that PWN to indicate other options. There's always other things considered. What other things were relevant? Maybe you have some more information you want to add, such as like this says he self-advocated for himself in reading, saying he doesn't want to be in there. That's fine. Maybe some new medication started. Maybe there was a situation in the home environment. All those things can be added in terms of other relevant factors that you as an IEP team discuss that really impact the child in terms and justify why they're receiving the services they are. So really the best practice is avoid leaving blanks and are using terms such as not applicable. When asked to describe, provide a comprehensive written account. When asked to explain, provide an adequate justification or reason. Write the prior written notice for a reader who is not knowledgeable in special education, so avoid those abbreviations and jargon. Make sure to proofread and avoid cookie cutter PWN statements. Also make sure the dates are correct. Don't do the copy and pasting from one student's prior written notice to another student's prior written notice and have the wrong name, have the wrong gender. Sometimes the IEP is for a female and we see he in the PWN. So don't do those things. Make sure it is accurate and that they're clear. That wraps up the IEP review. If you have any questions, I'm always available. Please remember to fill out the form stack after you've reviewed this video. Thank you. I'm gonna have to do it again. I don't like it. Oopsie.